Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. And welcome back to Magic Pill session. And as usual, as you all know, today we are going to discuss, every time we are discussing very important topic previously asked MCQs in competitive exams. Not only MCQ, we are discussing the additional golden points which is related to the MCQs. Okay, fine. So this time also we are going to start with a interesting topic. Many students are frequently asking for this topic, that is nursing theories. Actually, guys, this is part 1. So part 2 will be in the next session. Okay, so in part 1, what we are going to discuss, nursing theories, the main concepts, questions we are going to discuss here. Okay, fine. So let's begin the session with a motivational thought. Accept no one's definition of your life. Define yourself. Accept no one's definition of your life. You have to define yourself. If someone is saying that you are a loser, you cannot succeed in your life, don't bother about those things. You have to decide your life. You have to decide your goal. You have to decide your success or failure. Until and unless you are deciding you are failed, you are not at all a failure person. In Tamil, there is a saying, நீயா முடிவு பண்ற வரைக்கும் தோல்வி அடையவே முடியாது. நீங்க தான் டிசைட் பண்ணணும் நீங்க தோத்துட்டீங்களா இல்ல ஜெயிச்சிட்டீங்களா அப்படின்னு சொல்லிட்டு. So this is the saying. Okay. So with this saying, let's begin the session. So as I mentioned already, nursing theories, important MCQ point and vital point we are going to discuss. And if you like the video, please like it, share it. And if you watching the video for the first time, please subscribe the channel and then watch the video. So before entering inside the topic, as you all know that in February last week, there is a CRE, that is common recruitment exam is going to be there. And this exam is going to be conducted by the AIIMS. So whoever interested in more than 800 plus vacancies are there for nursing officer and senior nursing officer together. So if you like to clear the exam in the first attempt, please join the Metier Academy. The session is going to start from 20th of this month, Jan 20th. Okay, so join as early as possible. So online session is going to be there, and in the evening, that is from 3:30, the session will be there. All important vital points, previous year MCQ discussion, grand mock test, subject wise revision, everything will be cumulatively present in this session. So don't miss the session. If you want to clear the exam easily, please attend this type of review courses and clear the exams. Okay. For more details, the phone number is already mentioned here. Even in the website, the phone number and phone number is there. You can approach us either through the WhatsApp or through the call. Okay. So let's begin the session. So the first question is this one only. See, always in the question, we have to note the key points. Okay. So that is very, very important. So in this question, the theory that involves care and help through which the client attain total self-care. So in this question, what is the key point, guys? Self-care. What is that? Self-care. Once again, I will repeat the question. The theory that involves care, that is the first key point, and help. Care and help through which the client attain total self-care. That is the main key point. If this word, total self-care, this word is present, means what we have to think, which theory we have to think. Okay, so always go like a key points with the key points. Okay, so 4 points they have given here: Nightingale theory, Orem's theory, Peplau's theory, and Metier theory. So total self-care, this word is present in the question. Then we have to think about what theory. The answer here is option B, Orem's self-care theory. Orem's self-care theory. Let's discuss in detail about each and every theory key points. Okay, so whatever the key points on MCQ previously asked related to these options, we are going to discuss now. So watch carefully. If you have paper and pen, please write it out. The first thing what we are going to discuss is Nightingale theory, very famous theory because it is closely related to the nursing because of Florence Nightingale. Okay, so let's see the key points related to Nightingale theory first. Okay, the first key point is Florence Nightingale. She is the one who given this environmental theory of nursing. What theory? Environmental theory of nursing. Okay, so Florence Nightingale, which theory she has given? Environmental theory of nursing. So that is the first golden point. Okay, the second point is Nightingale developed her theory. In which year? In the exam, you will be getting the question. In which year she has developed this theory? She has developed this theory in the year of 1850s. 1850s, based upon the experience in the Crimean War. As you all know the story of Crimean War, she is the one, she along with a group of women, they went together and they have treated the soldiers, right? So Crimean War is the main war who made Florence Nightingale to develop this environmental theory in the year of 1850. Okay, so two key points already over. Nightingale means environmental theory, and when she has developed 1850s, and third important thing, based upon what she has developed this theory, based upon Crimean War. Three important point over. The fourth important point is Nightingale is also known as what? Very important point. Repeatedly this question asked in the exam. Founder of modern nursing. Nightingale is also known as founder of modern nursing. Lady with a lamp is generally we know that. Still, this point is very important. Founder of modern nursing is Nightingale. Okay. And in this environmental theory, what are all the key concepts present? What are all the key concepts present in this environmental theory which is proposed by or created by Nightingale? Cleanliness, air, water, light, hygiene, nutrition. These 6 things, because all these 6 things are coming from the environment, right? So environment means definitely air, water, light, nutrition, hygiene, cleanliness, everything is very important. Based upon this is collectively known as what? Environment. Okay. So based upon this concept only, she has developed this theory. Okay. So this is the fifth important point. Wherever I have highlighted, all these things are very important, guys. Repeatedly asked in the previous year questions. Okay. The next important point is, so this one you already know. I think no need to repeat this. The birth and death ceremony of Florence Nightingale. Very important. Nowadays, these questions are not at all asking, but still it is very important to know these two things. Previously, this was a repeatedly asked questions. Okay. So birth date of Florence Nightingale is 12th May 1820 and the death ceremony is 13th August 1910. Okay, so these are all the key points, very, very essential to know in the Nightingale theory, because already these questions are asked in the exams. Okay, fine. So the first option is over. That is Nightingale theory is over. Which is the right answer for this question? The right answer for this question is option B, Orem's theory. We are going to discuss now. Okay, so Orem's theory. So who have created this Orem? Dorothea Orem. This person developed this self-care theory. Okay, how the person is maintaining the health and well-being. So together it is called as what? Orem self-care theory. See, self-care is the keyword. Orems means immediately you have to think about what? Self-care. Self-care means you have to think about Orem. In the exams, either self-care will be there, otherwise Orems will be there, otherwise Dorothea Orem will be there. So whatever the word is there in the question, immediately you have to think about what? Self-care. Okay, sir. Orems means self-care. What is the other important point they can ask in the exams? Two more important points are there, frequently asked in the exam. So what is that? This is the second point. Main concept of Orem theory. In the exam, if they are asking among the 4 options, which is the main concept of Orem's theory? 3 main concepts are there, guys, in the Orem's theory. The first one is self-care requisites. Second one, self-care deficit. Third one, nursing system. Very important. This question asked many times in the exams. Okay. So self-care requisite. What is self-care requisite? These are all things that need to maintain the health, such as food, water, and exercise. Requisite means maintaining the health. Okay. Maintaining the health by taking a good food, good water, and doing exercise. Okay, self-care means what? Maintaining the health. That is the first concept. Second one, self-care deficit. If I'm not taking adequate food, there is no cleanliness, the deficit is going to be there. And nursing system means how we are going to treat the patient. Self-care requisite, self-care deficit, nursing system. These 3 are the concepts of Orem theory. Second vital point over. The third vital point is, how is Orem theory used in practice? Again, this is also very important question. Okay, so how Orem theory used in practice? In the exam, you will be getting question like this. In among the 4 options, in what situation the Orem theory can be applied? where the Orem theory can be applied. So you have to search for answer. Two answers are there. That is primary care and rehabilitation setting. We have to apply the Orem theory. Where we can apply the Orem theory? In primary care. It is mentioned here. See, primary care and rehabilitation, we have to apply the Orem's theory. Okay. The last point, this theory was developed between, when this theory was developed. So this theory was developed between 1959 to 2001. Nightingale environmental theory, 1850s, based upon the Crimean War, right? Same way, Orem's theory here, it was developed between 1959 to 2001. Okay, guys. So all these points are very important. Orem's means self-care deficit. Concept, self-care requisite. Sorry, Orem's means self-care theory. Concept means self-care requisite, self-care deficit, and nursing system. And where we can apply in primary and rehabilitation setting. And the period is 1959 to 2001. So these are all the key points. Okay, write it in the note. These key points. Only the key points you have to write in the notes. Okay. The next important theory, the third option is Peplau's theory. Very commonly asked question in the exams, Peplau's theory and phases of nurse-patient relationship. Among these phases also, so many times they have asked the questions. Okay, let's see in detail. Very important theory. Okay, so listen carefully. Peplau's theory. Peplau's has proposed interpersonal relationship in nursing theory. So Peplau's means what theory is there? Interpersonal relation theory. Okay, IPR, interpersonal relationship theory. It is developed by the Peplau's. Clear? So with this interpersonal relationship between the nurse and patient, we can maintain the therapeutic environment. We can make a therapeutic process. Therapeutic means what? Treatment. Okay, we are maintaining nurse-patient relationship means the treatment what we are delivering, it will be well and good. Okay, so Peplau means interpersonal relationship theory. Okay, this is the first golden point. Second golden point, frequently asked question is phases of nurse-patient relationship. Let me on the highlighter. Phases. 4 phases of nurse-patient relationship, guys. Very, very, very important. Very important. Okay. So 4 phases are there. Pre-interaction phase, introductory phase. It is also called as orientation phase. Okay. Third one is working phase. Fourth one is termination phase. 4 phases are there. Pre-interaction, introduction. It is also called as orientation, working, and termination phase. Okay, so let's see one by one what questions they have asked related to these 4 phases. Let's discuss that. Very important. So pre-interaction phase. See, you are working in a ward as a nursing officer. You are getting a call. One patient is transferring from ortho ward to your ward. Okay, and the patient name is so and so, and she is or he is suffering from this disease condition. Her age is this. These are all the investigation already completed. This medication is going on through a telephonic call. There will be a conversation between 2 nurses. You are getting the information from another nurse about a patient. This is called as what? Pre-interaction phase. Still now you doesn't met the patient. Still you are getting the information through a call. I'm giving just an example. This is called as what? Pre-interaction phases. Getting information about the patient. Okay, clear? This is not very important. From here, this point they doesn't ask in the exam so far. Second is very, very important. Introductory phase or orientation phase. Okay, introductory or orientation phase. So what question they have asked related to introductory phase? See, the question what asked is discharge planning decided at what phase of nurse-patient relationship? This is the question. Discharge planning is decided on which phase in the nurse-patient relationship? This question so many times asked in the exams. So discharge planning is planned in the introductory phase. Clear? Yes. So in the introductory phase itself, the discharge planning is decided. Clear? This is very important. And third one, working phase. It is also called as treatment phase. We are now introduction is over. Patient arrived inside the ward. And you are, as a nurse, you are giving the introduction about yourself. I am so and so. I am working here, and I'm going to treat you. Okay, and these are all the team members, doctors, physiotherapists, each and every person you are introducing, and also you are orienting to the environment. Here is the washroom. This is the nursing station. This is the bed for you. Okay, so you are giving an introduction and orientation. Okay, the third one is working phase. We are starting the treatment. Okay, in this working phase, two very, very important MCQ frequently asked in the exam, that is transference and counter transference, guys. Working phase means treatment. When you are giving the treatment, the patient is developing some kind of feelings or emotion towards a nurse. For example, the patient thinks that you are treating like my parents. You are looking like my brother. Okay, so the patient develops some kind of feeling toward a nurse, that is called as what? Transference. The same way, one more thing is that is counter transference. Okay, the nurse, she or he develops a feeling towards a patient. While giving care to a older patient, the nurse thinks that she is looking like my mother, he is looking like my father, she is looking like my sister. Okay, so this kind of emotional feelings, if it is coming, means that is called as what? Counter transference. Transference from patient to nurse, and counter transference means just opposite, from nurse to the patient. Okay, so these two things are happening in the working place. Please remember that. Okay, all the point wherever I have highlighted, please make a note of it. Very important, guys. And the termination phase means discharge phase. That's it. Okay, so counter transference and transference in working place, discharge planning in the introduction phase. Okay, so these points are very important. The last one, Peplau's theory. It is proposed by Peplau. The full name is Hildegard E. Peplau. Okay, and this is proposed or published on 1952. Okay, it is one of the first nursing theories. Okay, when it is published? 1952. Okay, years are very important. In a separate page, theory and year you have to write. Okay, for easy recalling. The next one is fourth option, that is Medellin Leininger's theory. So Medellin Leininger's, she proposed transcultural nursing theory. First important point is this one, because this question also asked many times. Transcultural theory was proposed by or created by which person? Medellin Leininger's. So what is transcultural theory? Very important theory. The transcultural theory means, as a nurse, I should know about the values, belief, religion, lifestyle, culture, family history about the patient in order to give the effective care. Understand? This is called as what? Transcultural nursing theory, and it is proposed by Medellin Leininger in the year 2 years are there. This theory is published in 1991 and it was developed in the year of 1950s. So 2 years you have to remember. Transcultural theory, Medellin Leininger's. Okay, fine. So here you have to know about values, culture, belief, lifestyle, all those things. Remember that. Okay, and few more theories are there. You can see here. In the exam, if you are finding in the question, that is 14 needs theory. One second, guys. One second. In the exam, if you are getting 14 needs theory, okay, so if this key point is present in the question, means immediately you have to think about what? Virginia and Henderson. What is that? Virginia Henderson. 14 need theory is there in the question, means you have to think about what? Virginia Henderson. Okay, so the same way, the 21 nursing problem, this word is present in the question, means you have to think about what? Abdullah. Okay, fine. And the same way, if you are getting goal attainment, this word in the question, means you have to think about King's theory. King's theory of goal attainment. Okay, if in case Ida, Jean, Orlando, this word is there, means you have to think about nursing process theory. Okay, once again I will repeat, listen carefully. 14 need theory. Here, actually, Virginia Henderson, this person has explained or identified 14 basic needs of the people to live in this earth. Okay, so Virginia Henderson means 14 needs theory. Please remember that. Second one, Abdullah, he proposed 21 nursing problem theory. 21 nursing problem theory. Okay, so identifying the nursing problems and create, means recorrecting it in order to deliver the good patient care to the patient. Okay, and King's theory means goal attainment, and Ida, Jean, Orlando means nursing process theory. In nursing process theory, as you all know, 5 components are there. That is assessment, diagnosis, planning, implementation, and evaluation. All these things we are writing in the nursing process, right? The same thing. This one, it is created by Ida, Jean, Orlando. Nursing process theory. Please make a note of it, guys. All these things are very, very important.